Dr. Larry Ohlhauser in the house now. And Doc, we did not plan that out, that the tool of the day was a tape measure, and you've brought in your own tape measure here from your Healthy CEO series. We're talking heart disease and obesity today.
We are, but just to remember, this tape measure is for you down the road. But we're talking about heart disease. Cardiovascular disease is a stroke or a heart attack. Certainly the commonest cause of death and premature death in women and men over 50 is from a heart attack or stroke. And what's interesting, 85% of those are preventable.
Wow.
And so what we recently have been looking at some interesting data. We always thought, you know, if I may be fat, but as long as I don't smoke, I don't have high blood pressure, my cholesterol's okay, I'll be all right. Well, recently some studies came out and said, no, that's not true. Somebody who's obese, and even if they have excellent cholesterol and triglycerides, they are much more at risk of having a heart attack or stroke than somebody who's simply overweight and actually has diabetes, smoking, etc.
Okay, so who is at risk then? I mean, for people that are watching at home that say the numbers might have been okay, I went for my latest physical, the doctor didn't call me back after my testing, there was nothing outrageously jumping off the results. Who is at risk? What are the risk factors?
Well, for the risk factors certainly are diabetes. So if you have a high cholesterol or triglyceride, you're a smoker, and you're obese are the biggest factors. But what we want to talk about is how do you know, how can you tell where you're in high risk? 3 ways. We've heard of body mass index. It's called a BMI, where we look at your height and your weight. And there's categories. Currently in Alberta, 60% of Albertans are considered to be overweight, 23% are considered to be obese.
Okay.
So doing a body mass index will give you some hint, but sometimes that's a very general tool. So probably one of the most significant ways of measuring your risk is measuring your waist size. So we know that the data says for men, any waist size over 40 inches, women over 35 is a sign of a higher risk to have cardiovascular disease. Or you can actually do your belly, your waist to your hip ratio. So in essence, we're looking for your hips to be bigger than your belly. And if the opposite is true, much higher risk.
Okay. Now, I get the feeling that you're talking about measuring waists. You're looking at me with that gleam in your eye. You've brought in your tape measure. This is going somewhere, isn't it?
Well, first of all, I just guess you're about 6 feet tall,
About
correct?
6 feet tall.
Okay, that's 72 inches. So I'd like you to stand up and measure your waist at your belly button. Leave your clothes on.
And if I can do this on the show, then anybody can do this at home, because we're broadcasting that I'm maybe a little bit more than what I should be right now.
Okay, so around your waist.
Okay, so where around the waist?
At your belly button. At your belly button.
At the belly button, okay. All right, good stuff. All the way around.
And what I'd like you to do then is take a real big breath in.
Okay.
And blow it all out. And now tell me what the measurement is.
I don't want to tell you what the measurement is.
Well, okay, you don't have to tell me. Here's the deal. Your waist size in inches, if it's greater than half your height in inches, so you're 72, so if it's greater than 36, you are at significant risk of dying far too early from a heart attack or stroke. That's the show and tell tip of the day.
This is going in a bad direction, Doc. I'm in the danger zone right now. I'm in the danger zone, okay? But you know what? This is good because it can be a bit of a wake-up call for us. So people at home maybe need to take this encouragement from you to do their own measurement, to pay maybe more attention to the risk factors. But let's focus right now on your tip of the day.
Well, the tip of the day is a measurement that you can do personally.
Okay.
So it's really, as we just did with you, your waist size should be less than your height in inches. And if that's so, you are less likely to develop a heart attack or stroke. Okay, good stuff. You can find Dr. Larry Ohlhauser's information on our website, breakfasttelevision.ca. Click on Inside BT, a speaker and author of The Healthy CEO and our health expert. Thanks, Doc.
Thank you.
We'll see you soon. Take it away, Michelle.